think if we are really grounding ourselves in the work in partnership, in accompaniment, as Paul would always talk about, Paul Farmer, this idea that we are really on a journey in collaboration, in partnership, and co-designing, we can help to mitigate that impact very much. I think the hard part too is that so it's a complicated question, right? Because there are some big NGOs out there that are providing direct services and not necessarily building capacity and not necessarily sort of shifting the agency to these places and these countries and these partners, but it's a really real phenomenon. And this is again where I think if we move to this model of one health system, one budget, one set of metrics, then the ministers of health and the ministries of health and the ministries of finance become actually the guideposts of where the money goes to. And if they choose to fund seed or they choose to fund, an agency or an organization to fill a gap that they don't have the capacity for, it at least is under that strategic plan and priorities and mission. And I think that's why it's going to be a very important shift that we start to make. I don't have a perfect answer because, again, we have built a system that's incredibly broken, and moving that system is going to take time. But cutting the system urgently isn't going to work either. But there does need to be a shift.